Hello, this is Dr. Moffitt, and this is another edition of our Facebook Live series. I'm the medical director of Arizona Reproductive Medicine Specialists. Our phone number is 602-343-2767. That's 602-343-2767. You're free to ask questions during this video. If you have questions later on, you can always call us and just ask to talk to a doctor today, and I, in the evening, usually give you a call back. You can also ask questions by our Contact Us. That's where you just, on our website, arizonafertility.com, you just go to the Contact Us and you can leave a question and we'll get back to you about that question. Again, the phone number is 602-343-2767. That's 602-343-2767, and you can get your questions answered. Anyway, the topic for today is guys, testosterone, yes or no. So we're going to be talking about guys taking testosterone and why and should you and that sort of thing. So I thought this would be an interesting topic because at least once a week, sometimes a couple times a day, I have this scenario. So a couple comes in, they've been trying for a little over a year to get pregnant. Nothing's happening, so everything seems normal in their history. We go ahead and order some tests, and one of those tests is a semen analysis. We order the semen analysis, it gets done, and I get the result back, and there's no sperm, zero sperm, zip. And so I bring the couple back and I go, wow, something's going on here. The testosterone zero. Are you by any chance taking testosterone injections or anything like that? And that guy goes, well, yeah. And I go, oh, really? Well, why are you taking those injections? And he says, well, I was kind of feeling tired, fatigued, kind of not on my game. And so I went to this clinic and they drew my testosterone level and it was kind of on the low side of normal. So I started taking these shots and now I feel great. And I'm taking testosterone. So the problem with that is that the testosterone in a guy is sort of like a birth control pill in a woman. So what a birth control pill has in it is it has the hormone estrogen and some hormone like progesterone. So an estrogen-like hormone and a progesterone-like hormone. And what that does is when the brain gets the product that it is trying to produce, it no longer stimulates that product to be produced. So what happens is there's these systems in the body, especially in hormone systems, where the body wants to make a hormone. So it makes the hormone, and then it has a way of detecting if that hormone has been made and how high that hormone is. And so when it sees that the hormone is made, then it says, I don't need to make the hormone anymore. So it stops stimulating that hormone to be made, and then the hormone level goes down. And that's the way a birth control pill works for the most part. Well, in men, the end product is testosterone. So the brain senses that there's plenty of testosterone around, so it basically says, I don't need to make testosterone because I got testosterone. So it stops the signal or the stimulus to make testosterone. Now, interestingly, the signal is the same in men and women. The signal is a hormone called follicle stimulating hormone, or FSH. And that hormone stimulates a follicle to grow in women. A follicle is something in the ovary where the egg grows. And so follicle stimulating hormone stimulates a follicle, which is an egg, so the egg gets made and ultimately gets released. And so the same hormone, follicle stimulating hormone, does a similar thing in the testes. It causes sperm to develop and testosterone to be secreted. And so what happens is when you give testosterone, the brain says, I don't need to make any more follicle stimulating hormone. I got testosterone, so it decreases the amount of follicle stimulating hormone that it's making, and therefore you decrease the stimulation to make sperm, and sometimes you end up with zero sperm going on there. So the bottom line is, if you are trying to get pregnant, do not take testosterone. So, well, what can you do? So if you're having these symptoms, if you're fatigued, tired, or whatever, in medicine, the basic thing is, well, if something's wrong, you go to a doctor, and the doctor's supposed to try and find out what's wrong, right? So I just, for fun, I thought I would Google the evaluation for fatigue. So what is the medical evaluation for fatigue? So I typed in medical evaluation for fatigue. Did that just this evening. And the first thing that pops up is this really nice article by the American Family Physician, and it basically describes the comprehensive evaluation of somebody complaining of fatigue. And interestingly, I went through the whole thing, and I didn't see the word testosterone once, either as a test that they would run or as a treatment they would give. Now, in fairness, the third article down did have drawing of testosterone as one of many things that they would check to figure out why somebody is having fatigue. So bottom line is, if you draw a testosterone level along with many other things, and your testosterone is in the low side of normal, maybe it isn't the testosterone that is causing you to have fatigue. And so, especially if you go to a testosterone clinic and they only draw a testosterone level or just one or two other things and don't do a comprehensive evaluation, it might be that they're masking some other problem. So the best thing to do is to have that evaluation. Interestingly, those articles talked about if you don't find any specific thing going wrong, then the treatment is exercise therapy, go to work, don't stay home, and improve your relationships with other people. So there are other ways to deal with that problem than testosterone. But let's say you do have a low testosterone, or you're finding that it really helps how you feel. Well, hopefully you never get on it in the first place, so you don't know how it helps how you feel. But anyway, the bottom line is there are other ways to address a low testosterone problem. Basically, what you do is you give a medicine that increases follicle stimulating hormone, or FSH. So instead of giving the end product, you give something that boosts the stimulation hormone that causes the production of the product, and at the same time the production of sperm. So the most common one is clomiphene citrate, or Clomid. The women watching this probably have heard Clomid. It's the most commonly prescribed fertility medication, and that medication basically just boosts sperm production in many cases, and can boost testosterone levels also. You can also take something called HCG injections. You can take a combination of clomiphene and HCG injections. A long time ago, we would also give pure follicle stimulating hormone injections, and that worked. It's just that that's pretty expensive. Have to take a daily shot, so it's kind of a drag. So we don't usually do the straight follicle stimulating hormone injections anymore. So bottom line is, if you are trying to get pregnant and you are tempted to take testosterone, don't take testosterone. Better thing to do would be to go see a urologist who treats this often, or a medical endocrinologist who knows how to do a comprehensive evaluation for this, and then knows how to give these other medications like clomiphene and HCG injections to help boost that. Probably the best thing to do if you're trying to get pregnant and having difficulty is to go ahead and go see a reproductive endocrinology and infertility specialist like me. That's what I am. I'm a reproductive endocrinologist and infertility specialist. Well, if you go see someone like me, they probably know the urologists that know how to do this, or the medical endocrinologists that know how to do this. So then, as part of your overall treatment as a couple to get pregnant, he can also get you on the right path to treating your testosterone deficiency, if you in fact have that, but doing it in a way that can actually help your chances of getting pregnant, or at least not hurt it. So anyway, bottom line, guys, testosterone, yes or no? No is the answer. And anyway, I hope that helped. Again, if you do have any questions, you can certainly give us a call. Our number is 602-343-2767. I'm Dr. Drew Moffitt, and we also on our website have a contact us, and you can just click there and put in your information. We can contact you. Our website is arizonafertility.com. That's arizonafertility.com. Hope this has been very helpful to you guys, and have a great evening. Bye-bye.